Well, I'm not going to say a lot about myself. It never comes off sounding as if you're modest, and so I'd like to remain as modest throughout my life as I possibly can. When I left these stone walls, actually weren't these exact stone walls, 40 years ago, I've delivered 10,000 babies since I left this building. So, and some of them may be in the audience. I mean, they usually are someone in the audience that I deliver. I know that Yoel delivered 3 babies in the last 4 nights. So, I mean, the thrill of bringing, life, I mean, being a man and not knowing exactly how it feels to give life or have life inside you. Delivering a baby is about the closest a man is ever going to get to it, and I applaud you for your courage, and well done. I think what it said, I am woman, I am invincible. You certainly are, believe me. If men had to have babies, this human race would have been gone a long time ago. About 1994, I was the chief of obstetrics, OB/S and Gynae at Etobicoke General, and I had an epiphany. I walked away for 6 months to kind of find my soul again. I kind of lost my way and was working hours that would be true. I wouldn't be alive today. I truly wouldn't be alive today. I was driving through red lights in the middle of the night, and it just came to a place in my life that I had to walk away, and found myself again, meditation and spirituality, and learned about natural medicine. And so I opened the Pettle Wellness Center in memory of my late mother who died of breast cancer, and I became very interested in getting people off of synthetic HRT and developing some hormone creams and evolving into a physician and allopathically trained doctor who was interested in integrative and preventive medicine. I hope to one day be part of the medical school, graduate with naturopathic school, and have them both have equal integrity and honesty towards each other and respect for each other. And I think the day that happens, you as a patient will be very well served. So I'll give you over to, thank you. I'll give you over to Yoel, and he'll introduce a little bit about himself, how he came to this stage as well, and he'll roll right into a case history, and we'll get going.
Well, I'm not quite at that stage in a number of ways. I'm still running through the red lights, getting to deliveries. I'm a family doctor who has a largely women and children, a practice largely composed of women and children. I've been out for 20 years, I think. And I also do a fair bit of emergency medicine, really a very general kind of medicine, and have tried in varying ways to integrate other modalities of care. I am also an allopathic, or am more of an allopathic physician probably than Alvin is, who is on that pathway. I started, for instance, I use not acupuncture, but hypnotherapy and hypnosis in labor. I've integrated different forms of naturopathic treatments for a variety of ailments, not just women-related ailments, but I'm really in many respects a neophyte, and have used Alvin as a consultant with my patients. As some of my younger patients are getting older, and many of them are hitting their 40s and 50s, or 30s and 40s and 50s. There are issues that are coming up, and with many of those things I feel lost sometimes, and I've turned to people like Alvin and others we have in our office, and naturopaths as well. When we discussed how we were going to do this, we decided that we would do it in much the manner in which we would interrelate, or do interrelate. I as a family physician with a particular case, and Alvin as a consultant giving me some direction. And so what I'm going to do is present the cases, and we have basically 3, with some brief talk about how I would do things, or what I might consider doing, and then pass it on to Alvin.